In 2015, Mapule tested positive for HIV. She was concerned about the chances of passing on the virus to her yet-to-be-born child. She was immediately put on antiretroviral treatment, and this year she gave birth to her second child, who, like the first, is free of HIV.
After I gave birth, I continued to take my medication, but also my daughter had a certain medication to prevent her from being infected. But it was not for long. After 6 months, she was then made to stop the medication. The nurses kept doing tests on her to check if she's HIV positive or negative. She was all right. She was HIV negative.
Mapule is among the women in Pretoria who benefited from early treatment. But despite treatment options available, South Africa's Gauteng region, which includes Johannesburg and the capital Pretoria, recorded 232 new infections among newborns in the first half of this year. The trend has worried health officials.
We were hoping that these numbers would be as close to zero as possible. Even though annual targets have been set and we are within the targets, we do still find it very concerning that in this day and age, with all the preventative programs that's available free of charge at our clinics, that we are still finding babies testing positive.
Health experts say there are a number of factors leading to mother-to-child transmission, like expectant women failing to present themselves at a clinic as soon as they fall pregnant, or some women not being aware of their HIV status. Other pregnant women receive medication, but the treatment is interrupted.
There's a variety of factors that play a role, whether it be migrating population or economic reasons or a multitude of reasons, but we say people should know. Let's make a plan, come to the facility, let's see how we can mitigate the factors that you do not interrupt your treatment because it does not have a good outcome.
Pregnant women in South Africa access HIV testing and antiretroviral therapy free of charge at public health facilities, and health professionals now want women to take precautions, present themselves early enough for treatment, and to also encourage their partners to test for HIV to prevent mother-to-child transmission. Caroline B., CGTN.